MHAI remains at the forefront of shaping a healthier, more compassionate Illinois. We are so excited for you to join us for our presentation, Beyond the Baby Blues, Recognizing and Treating Postpartum Depression, sponsored by MHAI and Hopeful Beginnings. Hopeful Beginnings is a nonprofit organization dedicated to supporting women and families during the perinatal period through comprehensive mental health services and adoption support. Located in Palantine, Illinois, the agency offers free counseling for postpartum depression and anxiety, grief and loss related to pregnancy, and challenges associated with adjusting to parenthood. Additionally, Hopeful Beginning provides adoption services for both expectant parents considering adoption and families looking to adopt, ensuring compassionate guidance throughout the process. Our presenter today is Connie Juarez, LCSW. She holds a master's degree in social work from Loyola University, Chicago, specializing in children and family with a subspecialization in immigration studies. She is a licensed clinical social worker and is certified in perinatal mental health. With 7 years of experience, Connie has worked extensively with children and families, supporting them through life transitions, stress, anxiety, depression, adjustment to parenthood, family dynamics, and grief and loss. Well, without further ado, I will turn it over to Connie.
Thank you, Caitlin. I really appreciate it. Welcome, everybody. Today, we are going to have a presentation about an intro to perinatal mental health. I'm very excited to come share a very big part of the work that we do at Hopeful Beginnings and being able to share just the passion of coming alongside families and being able to provide support during a big change in their lives. So a little bit of what today is going to look like we'll do some welcoming and introductions. We'll explore what is perinatal mental health, types of disorders, symptoms, risk factors, some cultural awareness, some treatment options. We'll talk about resources and then how to place referrals for Hopeful Beginnings. So we'll save the best for the last. And then, of course, our references will be at the end. Okay. So as Kaylee shared a little bit about me, but a little bit more background is I was a home visitor for 4 years in the city of Chicago. So sometime before the pandemic, during the pandemic, and after, I got to see a very different, unique perspective of how families interact during all different periods in their lives and transitions. And the last 3 years, I have been a perinatal mental health therapist, and I am a proud aunt. A friend just gave birth on Tuesday at 4 o'clock in the morning to a 10-pound, 4-ounce baby. It was awesome. And we will begin with sharing a little bit about our team here at Hopeful Beginnings. We are made up by amazing women who bring unique set of skills and strengths that help us be able to support our clients. I'm beyond proud to have these women as my colleagues, as our support system, as being able to be our team to help those in the community. Okay. And before we begin the presentation, I do want to take a note that the topics that we will be covering today can be difficult, can be challenging, can be triggering. So if at any point in time, someone may need to take a moment to themselves to go support themselves, reach out to somebody, take care of themselves, please do so. And if anybody would like to talk after the presentation, I am available, and my contact information will be at the end too. Okay. So we will begin. So what is perinatal mental health? So let's define what the perinatal period is. So it includes pregnancy, post-loss, and 12 months postpartum. And we want to begin by saying that perinatal mental health disorders, they affect everyone, every age, race, ethnicity, income, culture. It does not discriminate. So we need to address it. 1 in 5 women and 1 in 10 men will experience depression or anxiety during the perinatal period. So it can be anybody. And sometimes it's a surprising fact that, yes, men do experience it too. And left untreated, it could lead to premature or underweight birth, impaired attachment, or learning and behavioral challenges, can even increase the risk of maternal mortality. So we need to address it. And one thing I truly want everyone to know, that what we're going to take away is that this is treatable. You are not alone. You can feel better. You will hear me repeat this many times throughout the presentation. That's the one thing I want to take away, is that we can spot this, we can acknowledge it, we can get the support, and you can feel better. Okay. So we'll begin by going through different disorders. And so we want to acknowledge that there is perinatal depression, there is perinatal anxiety, perinatal obsessive compulsive disorder, OCD, perinatal post-traumatic stress disorder, PTSD, bipolar mood disorders, and perinatal and postpartum psychosis. So we will be going through symptoms of each one. Now we're going to acknowledge that some of them may have overlapping symptoms. So we'll acknowledge them that they may be present in many different disorders. We want to acknowledge that we also will be talking about specific symptoms for each disorder. My biggest thing I want to point out is that it's really important to talk to a trained professional so we can acknowledge what the person is experiencing so that we are able to give them the treatment they need so that they can feel their best selves. So we'll begin with perinatal depression. So symptoms, what can that include? So we are looking at feelings of anger, irritability, and or rage, lack of interest in the baby, disturbances of sleep and appetite, crying and sadness, feelings of guilt, shame, or hopelessness, loss of interest, joy or pleasure in things you used to enjoy, and possible thoughts of harming the baby or yourself. Now, one thing I want to note is we are experiencing these symptoms for not just a couple days or a couple weeks. We are experiencing these for a longer period of time. We want to acknowledge this is not the baby blues where a couple days after giving birth, someone is experiencing, feeling down or can't explain why we're feeling some sadness or crying. Like this is feeling this throughout time. And so I want to point out what are feelings of guilt? These vary. This is very unique to the person. While working with parents, I've heard, I feel guilt because I'm not doing enough. Or I feel that I need to be spending more time with them. Or I have guilt about not or returning back to work. Guilt and shame, it's going to look very different for every individual. These feelings are valid. We want them to be able to share them. Sometimes families are scared to share these feelings because they feel like, oh, I'm a bad parent because I feel this way. No, it's because we need some additional support to address these feelings so that we can then work through them, acknowledge them, make some changes so that you can feel your best self to parent. And that leads us to our perinatal anxiety. So some symptoms kind of include constant worry, feeling that something bad might happen, racing thoughts, disturbances of sleep and appetite, inability to sit still. Physical symptoms include dizziness, hot flashes, diarrhea, nausea, feelings of anger, irritability, and or rage, nervousness, on edge, anxious, trouble relaxing. We want to note that when a parent is experiencing these symptoms, we also want to take into consideration they are getting up every couple hours to feed a child. They may be going through a grief and loss. They may already be experiencing lack of sleep because of what is happening around them. And then we're adding an additional component of experiencing this anxiety. We're not feeling our best at this moment. And that is just going to amplify these symptoms, whether they be experiencing the constant worry or physical symptoms of the dizziness, the hot flashes, the diarrhea. Our game plan is to be able to acknowledge, hey, something is not right. I'm feeling off. I want to acknowledge it. I can't put my finger on it, but I know I can reach out to a support that could be Hopeful Beginnings, and we'll go through some resources towards the end, or Postpartum Support International, being able to then be guided into the support I may need. And then we continue with perinatal obsessive compulsive disorder, OCD. And this is where we're going to get into the conversation of intrusive thoughts as well. So obsessions, also called intrusive thoughts, which are persistent, repetitive thoughts are mental images that are often related to the baby. These thoughts are very upsetting, and I want to point out that they are unwanted. You don't want to be having these thoughts. And then we go on to compulsions, where you may do a certain thing over and over again to reduce your fears and obsessions. This may include things like needing to clean constantly, checking things many times, counting or reordering things, and or avoiding triggers. A sense of horror about these thoughts, fear being left alone with the infant, hypervigilance, and protecting the infant. So we'll begin with intrusive thoughts. So these are unwanted thoughts, and we do not know, hey, what is going on here? And one thing I'm going to begin is it's not your fault. You're not a bad parent. We can work through this. And what I'm trying to explain is the body is truly trying to prepare and be preventative and be protective. So it's thinking worst case scenario, what's going to happen? What are we going to do? So then it's thinking, well, what if I drop my baby? While working with parents, I've had moms who are explaining to me, I am walking down the stairs and I'm thinking, what if I just drop my baby? And I'm like, okay, let's sit with that thought. And we talk about, we're trying to think about the what ifs. We're trying to be protective. We're trying to be preventative. We're trying to be cautious. But at times, that maternal instinct is coming in and it's going in overdrive. And these thoughts are just being over and over and over processed in the brain and shared. And so what we're trying to do is bring it to a calm where we're acknowledging, providing some reassurance. We want to know that when these thoughts are present, even when we are in a relaxed mode or we're trying to, take the day off, decompress a little bit, and they're still present, okay, this may be a sign that we want to get this addressed. Why? Because it can be consuming. It is overwhelming. And then that leads to then experiencing more feelings of stress and anxiety related to the situation we're in hand. And I want to know that all mothers experience intrusive thoughts. They are all present. Fathers experience them too. Parenting individuals experience them too. And so we want to have the conversation about you're not alone. We can work through this. It's all about acknowledging something's going on. And I would like to explore this further. And if you're open to it, receiving some support. And so then we move on to perinatal post-traumatic stress disorder, PTSD. And with this conversation, we are talking about flashback of a traumatic event, which in this case may have been childbirth itself. We're experiencing nightmares, avoidance of reminders associated with the event, including thoughts, feelings, people, places, and details of the event. A sense of horror about these thoughts, persistent increased irritability, difficulty sleeping, hypervigilance, and exaggerated startle response, anxiety and panic attacks, feelings of sense of detachment, avoidance of aftercare following a trauma birth. What we want to know is that what one person perceives as traumatic may be different to another. And we want to validate that every person's experience is different. But if one person perceives something traumatic, we want to address that. We want to be able to rally up the support, to create those referrals so that they're able to talk to someone and to acknowledge it. So it isn't preventing them from returning to the doctor. It isn't preventing them from bonding with their child so that they are able to be present for themselves and their family and those around them. At this point in time, I do want to do a check-in if anybody may have any questions about the disorders that we have discussed so far, or if anything has come to mind, please feel free to share. And I think we can add to the chat if anybody has any questions or would like me to explain anything any further. And we move forward with bipolar mood disorders. So symptoms can include periods of severely depressed mood and irritability, elevated mood, higher energy than normal, rapid speech, little need for sleep, racing thoughts, trouble concentrating, overconfidence, impulsiveness, poor judgment, distractibility, grandiose thoughts, inflated sense of self, importance, in the most severe cases, delusions and or hallucinations. Childbirth may be a specific trigger for a manic episode, which could then be followed up by the onset of depression. And then on to our last perinatal mental health disorder is perinatal postpartum and psychosis. I want to note that if an individual is experiencing psychosis, we want to get them immediate attention, whether that be calling local emergency services or taking the individual to your local emergency room. Our biggest goal is to ensure safety of the child and of the parent. And symptoms may include delusions or strange beliefs, hallucination, seeing or hearing things that aren't there, feeling very agitated, hyperactivity or having more energy than usual, severe depression or a lack of emotion, decreased need for inability to sleep, paranoia, suspiciousness, rapid mood swings, and difficulty communicating at times. When a person is experiencing psychosis, they are having a break from reality. That is where people around them, we need to step in to ensure safety. Now, as we talk about these disorders, my big reminder is they're treatable. They are treatable, and we're going to definitely have a conversation about what are treatment options, what is combinations. We also want to touch base about risk factors. So when someone identifies with a risk factor, it does not necessarily mean they're going to experience a perinatal mental health disorder. It is explaining that there may be a higher likelihood they may experience it, does not guarantee it. I want to remind that there are protective factors that also come into play too. But also identifying being part of one of the high stress parenting groups can be a risk factor. So that includes queer and trans families, military families, teen parents, parents of multiples, single parents, parents of color, near-miss survivors, and those who experience a pregnancy and or infant loss. And I want to also acknowledge a person may identify with multiple of these parenting groups. And so that we want to take into mind and also be able to have that awareness so that if we are noticing something, okay, well, then I know I can reach out to have a further discussion with either a trained professional, a doctor, a counselor, a social worker to continue to explore, what is going on? What can we do? And then we continue with some more risk factors. And reminder is you may identify with multiple of these risk factors, does not necessarily mean you will experience a perinatal mental health disorder. It's just that we are creating this awareness that, okay, I identify here, I may be at a higher likelihood of experiencing something. Okay, let me be aware of that. So that is a personal or family history of mental health conditions like depression, anxiety, perinatal depression, bipolar, OCD, premenstrual dysphoric disorder, inadequate support for caring for the baby. That's a big one. How many times we're working with parents, we say, hey, you know what? I don't have my community around me. Or, you know what? People had to return back to work. I don't have that support there. Or I'm doing it on my own and it's really difficult. You're right. It is very difficult. We want to validate that. And what can we do as we are trying to provide support? Can we have someone come visit you? Can we reach out to a friend? What can we do to be able to provide additional support for you? Financial stress. Yes. A history of abuse, marital stress, an unplanned pregnancy, an unwanted pregnancy, complications in pregnancy, birth, or lactation, a major recent life event, including loss, moving, relocation, or a job loss, pregnancy or an infant loss, parents of multiples, having an infant in the NICU, fertility challenges, a thyroid imbalance, and any form of diabetes, teen parents, and adverse life effects. And there continues to be more risk factors as we go on to the next slide. High levels of stress. And we have complications, in past pregnancies or in the current pregnancy. Being a single parent, a negative or low self-esteem or self-efficiency, relationship challenges, childhood sexual abuse or previous sexual trauma, living through experiencing a traumatic event, feelings of powerlessness and or lack of support and reassurance during the delivery, traumatic or disappointing birth experiences. In addition to substance use has been found that increases the risk of bipolar depression. And then the most significant risk factor for perinatal and postpartum psychosis is personal or family history of bipolar disorder or a previous psychotic episode. So we are creating that awareness again of if we identify with these risk factors, okay, what conversations can we have with our medical providers, with our team around us of what are we keeping an eye out for? And on this next slide, I have a beautiful handout that is from Postpartum Support International, and it gives a little overview of the different types of perinatal mental health disorders, symptoms, risk factors, treatment. I cannot tell you how helpful this handout is when talking with parents about what they could be experiencing, and we're having these conversations. They go, I felt that, or this sounds really familiar, or you're putting into words what I've been experiencing. I'm like, beautiful. Let's talk about that. Give us a visual representation, and then that will guide our conversation to what can we do to see if we can reduce these symptoms, bring you some relief from what you're experiencing, and get you to where you want to be. And as a reminder, symptoms may overlap as the reason to speak with a trained professional to receive the correct diagnosis and treatment. At this point in time, if anybody has any questions, feel free to ask. Okay, we do have a question. All right, so I have a question. How common is it for non-parents to have intrusive thoughts in regard to newborns who may be in their care? That's a great question. So how common? It is also their parenting journey, and it is common. When they take on that role, we are going through a major adjustment. Now, there's a percentage rate at this rate. I do not have a number, but I do acknowledge that when a parent comes into play and we are having a conversation of they will also experience, depending on their bond also with the child. And in addition to who is identifying also as the caregiver. So we can say non-parents, but there could be caregivers who are taking on that responsibility, and that is also an adjustment to their role. That's an adjustment to their life. And I'll give the example of when grandparents take on the role and they become the main caregiver, and they can also go through experiencing different perinatal mental health disorders. And then for our next question, I see typical length of treatment for perinatal postpartum diagnosis. Okay, so for the length of treatment, so first of all, we want to acknowledge when they are getting diagnosed. So some people have the ability to be able to talk to their provider. Some people reach out on their own, and we are truly going to work with them until they feel they have reached their goals. Our goal here at Hopeful Beginnings is we've worked with families for a couple months to 6 months to a year to almost over a year. It really depends on the individuals and what they're experiencing and what's happening around them. A really big explanation I like to give is experiencing a perinatal mental health disorder. There's internal and external factors too. And when we can get support on both sides, then we're really able to see, okay, where are we going? How are we meeting our goal? Thank you so much for the questions. Now we're going into, I see another question. It's great. What are some early signs that non-mental health providers, families, friends should pay attention to? At what point should we encourage them to seek support? How would we approach them to encourage this? This is a great question, and I would love to keep this one on hand as we get into the resources that we have. I think we'll be able to answer it perfectly well. Thank you so much, Caitlin, for asking. Okay, and now we're going to go on to treatment options. Yes, all perinatal mental health disorders are treatable. That is one thing I want everyone to take away from us. We have many different types of treatment options, and also being able to put them together so that they can take a variety, a hybrid of them, and use what's going to be best for this individual. And so we begin with social supports. I cannot tell you how helpful families have found it to have a home visitor, to have a doula, to be able to go to a group that meets. Those social supports create that community, create that help, be able to have someone come into the home to visit you, being able to have a doula be with you during delivery and or after, in addition to having a home visitor come and visit. Was it be once a week, twice a month, and to attend groups to talk to other parents or other individuals who are going through a similar situation. In addition to, we have the conversation about meeting basic needs. So that is really big about when you're talking about creating this foundation. We want to acknowledge parents, are we eating? Are we sleeping? Are we drinking water? Are we taking unnecessary medication? And when we hear, no, we're not doing that, but let's start there. Let's start to helping ourselves and being able to then take on more to then reach out and read that support or reach out to a friend or share with someone what's going on. We also have intensive outpatient programs. If we feel this is necessary, okay, we can make that referral. We can connect you. In addition to inpatient psychiatric treatment too, if we need to be able to say, you know what, I may need additional support, that is an option too. We are lucky to be able to have those services and being able to connect clients to them too. It is doing a little bit of research of navigating insurances, but hey, we can help with that. In addition to this medical treatment, it is really great that we are able to have the first FDA oral medication approved to treat postpartum depression. In addition to, we have other antidepressant medications that are SSRIs, selective serotonin reuptake inhibitors. And then our second line of defense, we have SNRIs, serotonin norepinephrine reuptake inhibitors, the second line of defense. And then third is these are the medications that are our last options because everything else we've tried has not worked. Tricyclic antidepressants, and we want to have that be the last option. But this is how I really like to reassure families that there are options. So they say, you know what, this isn't working for me. Okay, we can try something else. There are many different options. There also are options that are safe for breastfeeding too, and safe to take while you are pregnant. But the biggest thing is to say, we have options. And that if you're willing to try, we're willing to take the time to figure out what's going to best work for you. And then in addition, of course, mental health counseling. Yes, there are evidence-based perinatal therapies. We have cognitive behavioral therapy, interpersonal psychotherapy, peer support groups, group therapy, mother-infant therapy, and education. And there's many, many more that you're able to then have that one-on-one or be in couples or be in groups to be able to talk about what's going on. We are trying to take that stigma off of needing to be this picture perfect family. Not at all. Parenting is beautiful. Parenting is tough. And I cannot tell you how many times I have conversations with families, with parents about it needing to look a certain way. And parenting needs to be what is best for the parent and for the child. And then we go on to, all right, we want to do some screening. We definitely want to have a conversation about what is the screening? Screening is not diagnostic. When can we include these screenings? When an individual is working with their doctor, whether it be a home visitor, whether it be with a doula, screenings can be done at the first prenatal visit, at least once in the second trimester, once in the third, 6 weeks postpartum, and repeated at 6 and 12 months. And then, if possible, while the child's being seen at 3 and 9 months pediatric visits too. What screening can we use? One of my favorite, the Edinburgh Postnatal Depression Scale. I could probably cite this to you without needing to read it, but it's so helpful to be sitting with an individual, reading the questions, having a conversation about in the past 7 days, what have you been feeling? And it helps us guide the conversation. It helps us acknowledge what's going on, how they're feeling, and be able to be like, okay, this is where we can acknowledge we want to slowly bring this down, reduce these symptoms. And this depression scale, it's great because it comes in many different languages, helps guide our conversation. And then as we continue to work, we will do it again and see if we're able to decrease that score. Our highest score is 30. Our biggest goal is to bring that down as low as possible. I'm very transparent. No one is ever completely stress free, but we're trying to bring it down to a manageable point that we don't feel that it is truly inhibiting our everyday life. And then let's not forget, and I can talk about this for a long time, but cultural awareness. So I really want to have the conversation about taking into consideration, where is the person from? What are their beliefs? Every single person has a different idea of what is parenting with where they grew up, how they grew up. So we're taking into consideration country of origin. With my experience in working with the Hispanic community, I have a lot of conversation that revolves around, well, back where, I am from, we do something called a cuarentena, which is the 40 days postpartum. And you stay home and you don't go out and you keep to yourself. And in other countries, family members come visit you and they are there to help clean, cook, help bathe you, help take care of the child, keep you company throughout those 40 days so that you have that time to recover and bond with your child. And so when I talk to women here in the United States who are new to the country and they're doing this practice, they'll come and have a conversation and say, I feel isolated. I feel lonely. I feel a lack of my community. And we want to validate that because, yeah, you are parenting in a whole different country. We're also talking about navigating a whole new system of a healthcare system, a schooling system, a transportation system. Even how we get our groceries is so different. And we're navigating all of that. And it's hard. And yeah, that is a lack of support in itself. We also want to take into consideration being a recent immigrant, their language. Imagine how hard it is to ask for help if you don't speak the language. Their cultural backgrounds, their beliefs, their careers, their role in their family, their religion and spirituality, their beliefs, their values, their food, their politics. I cannot tell you through talking with more parents about their role in the family where, there may be more traditional roles and it is stressful to be the main caregiver on top of maybe caregiving for other children as well. And so we talk about these stressors that are related to experiencing a perinatal mental health disorder. Okay, I'm going to pause for a second and see that we have some questions. And then we have one more question about how do you respectfully confront and overcome cultural beliefs with the blues will pass with support with time? This is a great question. So how do we have the conversation of, these are the baby blues. They're going to pass. You'll see in a couple days. Well, we bring up, well, what have you been experiencing? How long have you been experiencing for? And one of the biggest conversations I have is if we could feel better, would we want to explore that? And there is a lot of cultural beliefs also with attempting medication. And no, I don't want to do that. I want to do it on my own. I don't want to put something foreign in my body. And so then we sit with that conversation and we explore it with what are your fears? What is our fears if we acknowledge that it's not just the baby blue? And we have the conversation about, okay, and if we can do something to make it better, would you like to try? And they'll be like, maybe I'll think about it, and that's fine. I cannot tell you how many sessions we go through of, I'm going to think about it, and that's fine. And I will continue to have that conversation with them over and over and over again until they say, okay, I want to try, or you know what, Connie, I don't want to try this. And that's okay. We will continue to explore more. And in regards to continue with cultural beliefs, we do want to be respectful and we do want to take into consideration in culture believes, maybe postpartum depression, we don't acknowledge that. So then, how can we bring the conversation of should we talk to somebody? When working with a lot of my families in the Hispanic community, a lot of our sessions, we call them conversations. And we say, these conversations have been really helpful. And I'm like, great. My job is to try to meet you halfway with, let's just talk about what's been going on. And that I feel opens up the door to being able to have further conversation about what they're feeling and what they're experiencing. And so we go on to hear some of our resources. So I had a really great question earlier about what are some early signs. And early signs, we're talking about we are experiencing the sadness, crying. We also are experiencing maybe not wanting to care for the child or maybe needing to have distance from the child too, or not feeling like ourselves. And that is a very difficult one to acknowledge because it's for the individual to be able to identify, but that will go that as, let's say, for example, a family member, a partner, somebody else in the home, we're noticing, we're not eating, maybe we're not holding conversation, maybe we're not wanting to care for the child. Okay, then we're going to keep an eye out for that, and then we're going to have the ability to, when we feel it's appropriate, have a conversation of like, how have you been feeling? What's been going on? And some people may feel open to sharing and some may not. And we want to accept that too. And we will provide support in regards to if a meal can be offered or if help can be present. We want to try to offer that, but we also acknowledge that may not always be the case. And now, if we get to the point that someone is open to receiving resources or wanting to explore this further, Hopeful Beginnings is great. I'm going to definitely explain a lot about our process and what we are working towards. And with Hopeful Beginnings, we are free in-person or virtual counseling. Give us a call. Let's talk about what's going on and what our process looks like. Is they'll give us a call or they'll access our website. We'll explain to them how the program works. And a nice overview is, we provide counseling in the areas of prenatal, postpartum, depression, and anxiety, adjustment to parenthood, and grief and loss. Calls can be, sessions are in person, over the phone, or it can be a hybrid. I have people come in and then it's over the phone, or it's over video call, whatever they're comfortable with. And once they call, we take in their information, we'll send them an intake, we'll then set up an assessment. Why do we do this assessment? We want to ensure that we are the best fit for them. And if we're not, then we will find other resources that will be for them. And then we go ahead and they're assigned to be with one of our workers, and then we begin. Our main job is to come alongside the individual, to provide them support, to validate their feelings, and to be able to let them know you will feel better. It'll take a time. We are a team. We will get through this together. In addition to, we have Postpartum Support International. They're great. You can give them a call. You can also text them. They have great groups available. We can connect you to resources to your area too. In addition to, if someone's experiencing a crisis, we have the 988. We want them to be able to receive the support they may need. And again, if you're in a setting that you feel that someone is in danger of hurting themselves or somebody else, that is where we call our local emergency services, where we take the individual to their local emergency room. And then if families have a fussy baby, which happens, it does happen, there is the Fussy Baby Network that will work alongside you to help soothe your baby. There are options out there. Families do not feel that they have to go through things alone. There are resources. Asking for help is scary. When I tell you, with working with many different families, one of the biggest things that they say they take away from just these conversations, sessions, groups, meetings is being able to ask for help. And if this is going out to anybody, is that help is here when you want it, and many resources are available. And our next slide is to have a client referral will be placed, you can take a picture of our QR code, take a picture itself. It will connect you right to a referral form. We get that information. We go ahead and contact them and start that process. And then the following is the QR code for our website and my email address. If anybody would have any questions or want to explore more, or just have any questions about becoming perinatal mental health certified, or questions about the more services that we provide, or just wants to chat more about what we discussed today, please feel free to reach out. I believe knowledge is power, and the more we have it, the more we can share. My biggest takeaways is we are creating awareness about perinatal mental health disorders. We are creating awareness about being able to identify there are resources that we can take this for ourselves or for somebody around us too. Please let me know if anybody has any questions. Thank you so much for joining us today.
Thank you so much, Connie. That was amazing and so informative. If there's any additional questions, feel free to put in the chat, or you could unmute yourself and participate in this discussion. I guess I have a question. Do you think what are some common barriers that you notice when maybe as a community that we could help work together to overcome?
Number one, I have to be with the stigma. I cannot tell you how many times I've heard, I didn't want to say something. I didn't want to share. I didn't want to be honest with what's going on. And through conversations I hear, well, someone will ask me, how am I doing? And do I really tell them that I haven't slept, I haven't showered, I'm not eating well, and I'm really stressed out? No, I just say I'm doing well. And so I think a really big part is being able to be acknowledging that parenting in itself is difficult, and it's okay to share that. It is okay to share with a friend. It is okay to share with a neighbor. It is okay to share with the community of it's hard, and that's okay. And I think that's where I start the conversation with acknowledging parenting is not picture perfect. One does not wake up and know everything about parenting. You are also learning the same way too. I think being able to go on to the communities and do workshops about what people are experiencing, how it is impacting them. I cannot tell you doing other workshops in other areas when I just see heads nodding of like, yep, I felt that, or I didn't have that conversation with somebody. I wish someone would have said, it's okay to not be okay.
Yeah, I love that. Definitely. That speaks to me on such like a deep level. Because I think one of as you stated, the stigma, the mom guilt, like being the perfect mom, being good enough, like even more than good enough. Like, did we do enough? Did we bathe enough? Or are they clean enough? Are they dressed well? Do they look presentable? Are they warm enough? Are they in the right activities? Like, it never stops. And
yes, are you spending enough time with them? Is this enough interaction with them? Are they eating enough? Oh my gosh, they had McDonald's. It's okay. It's okay. Or they're watching TV. It's okay if they watch TV. There are protective factors too. We're trying to take that off. And so much is compared to what you're seeing around you. And so much conversation is what you're seeing is only half of what's happening. You don't know what's happening behind that screen. You don't know what's happening behind that family on YouTube or TikTok or Instagram or on Twitter, all these different things. You don't know what's happening behind those scenes that they're getting that picture. Moms are telling me, all I wanted to do was enjoy a parade, and it was so difficult. But we got this great picture. I'm like, yeah, look how much work went into that picture, but we don't know that because you're just seeing something on a screen.
Mm-hmm. Yeah, definitely. And I could definitely attest to like how important education and awareness is, even just being able to talk about it. Because I have two daughters, but a little self-disclosure, I guess. My first, I was definitely like in hindsight, I'm like, oh, I had some postpartum depression, anxiety, but I had no idea. I was a new mom, prior military, so we were far away from family and support. I had no clue, and I was like, this something is not where I think it should be, but I didn't have the words. And then once I learned, like, okay, this is depression, like PPD and anxiety, it did help my second one run so much smoother because I knew what it was and knew how to prepare for it. So I could definitely say, like, attest to how important education and awareness is and reducing that stigma.
And how much we're also trying to work with, medical providers of doing these screenings and having these conversations, because what a space to be when you're talking about your pregnancy, your physical health, to also talk about your mental health.
Yeah.
And doing these screenings and knowing like, hey, if you're feeling or acknowledging this, you can come talk to us. How many times have we gotten referrals from OB's office of like, you know what, I'm sending somebody over, and yeah, my doctor told me to reach out. Beautiful, we're here. Let's talk about this now. And they're like, I didn't know something like this existed. We are such a specific area of services that we provide, but there is a massive need for this.
Mm-hmm. Agree. There's one question in the chat, but I think Kelly was helpful and answered it. But in case you know of any other groups, are you aware of any other support groups for men, new fathers who may also experience PPD? Kelly has suggested the Dovetail Project. I'm curious.
That's awesome. And Postpartum Support International also has dad groups too. They meet monthly, and so you're able to kind of sign yourself up and you're able to meet virtually with them. And it's a dad's group too. It is very important that all parenting individuals get the support they need to, in addition to also non-parent, but who are main caregivers. There is that stress. There is that anxiety too. We want to make sure that everyone feels that support. Parenting is so beautiful, but it is hard. And we want to make sure that people do not feel that it is their fault. It is not, that there's nothing wrong with them, that we're going through an adjustment and things can get better.
Yes, very well said. Well, thank you so much, Connie. I appreciate your time, your wealth of knowledge. It was amazing, and thank you to our audience and their wonderful questions. If there's any other additional thoughts, there's contact information here, and you can also reach out to MHAI.
Thank you, everyone. Have a great rest of your day.
Bye. You too.